Hello friends, welcome to the channel Duty Academy. So in this video I am discussing a question and the question is regarding the cranial nerve. So dash is a cranial nerve 5. Options given here are olfactory nerve, optic nerve, facial nerve and trigeminal nerve. So this question helps you to understand and helps you to remember the cranial nerves. So are you able to give the answer for this question? The dash is cranial nerve 5. Yes, the correct answer is option D, that is trigeminal nerve. The correct answer is option D, trigeminal nerve. Okay, so now we have to discuss the cranial nerves. We will have a fast and quick discussion about these cranial nerves. So first is cranial nerve 1. Cranial nerve 1. Or the first cranial nerve. Which is the first cranial nerve? That is olfactory nerve. The first cranial nerve is olfactory nerve. Olfactory nerve. Then the cranial nerve 2. So this olfactory nerve is a sensory nerve. It is responsible for the sense of smell. Then the second cranial nerve, that is optic nerve. Optic nerve. This is also a sensory nerve and it transmits the visual information from the retina to the brain. Optic nerve is transmitting the visual information from the retina to the brain. That is cranial nerve 2. So that is also a sensory nerve. Then we have the third option, that is a third cranial nerve. That is cranial nerve 3. Cranial nerve 3. That is oculomotor nerve. Oculomotor nerve. Oculomotor nerve. So that from the term itself it is clear, it is a motor nerve. It is a motor nerve. It controls most eye movements, including the constriction of the pupil and maintaining an open eyelid. So oculomotor nerve is a motor nerve. Then we have the fourth cranial nerve, that is trochlear nerve. Trochlear nerve. This is motor nerve. This is a motor type, that is the function is it controls the superior oblique muscle and it helps in the downward and inward eye movement. Downward and inward eye movement. So trochlear nerve is the fourth cranial nerve. Then the fifth cranial nerve, that is our question here, which is the cranial nerve 5. So we know we got the answer, trigeminal nerve. Trigeminal nerve. Trigeminal nerve is having both motor and sensory functions. It is having both motor and sensory functions. So the sensory means the sensory to the face and motor function means motor control of muscles for chewing. So trigeminal nerve is having 3 branches. Trigeminal nerve is having 3 branches. One is ophthalmic branches, ophthalmic, then maxillary branch, maxillary and mandibular branch. Mandibular branch. And this trigeminal nerve is the largest cranial nerve. So trigeminal branch is the largest cranial nerve. Now the sixth cranial nerve. Which is the sixth cranial nerve? That is abducens nerve. Abducens. So abducens nerve is a motor nerve. Abducens is a motor. It controls the lateral rectus muscle, that is it is responsible for outward eye movement. Outward or abduction of the eye. Abduction of the eye or outward eye movement. So it is a motor nerve. Then we have the cranial nerve 7, that is the facial nerve. Facial nerve is also having both motor and sensory functions. It controls the facial expressions. Then it's having the functions of secretion of saliva and tears and provide taste sensation to anterior 2/3 of the tongue. It also provides taste sensations to the anterior 2/3 of the tongue. So these 7 cranial nerves we discussed. Next is the 8th cranial nerve. The 8th cranial nerve is vestibulocochlear nerve. Vestibulocochlear nerve. Vestibulocochlear nerve. It is a sensory nerve. It is responsible for hearing. The cochlear part is responsible for hearing, and the vestibular part is responsible. The vestibular branch is responsible for the balance. So this is responsible for hearing and balance. The vestibulocochlear nerve, it is a sensory one and it is responsible for hearing and balance. Then we have the 9th cranial nerve. 9th cranial nerve is glossopharyngeal. Glossopharyngeal. Glossopharyngeal nerve, it is also both sensory and motor. It provides taste sensation to the posterior third of the tongue. Posterior third of the tongue. It provides taste sensation to posterior third of the tongue. And also it controls the part of swallowing. So that's about the glossopharyngeal. And we have the 10th cranial nerve, that is the vagus nerve. Vagus nerve. Vagus nerve. This is also both sensory and motor functions are there for the vagus nerve. It regulates the heart rate, respiratory rate, and also the digestion. Now the 11th cranial nerve is accessory nerve. Accessory nerve. So that is a motor nerve, and it controls the sternocleidomastoid and trapezius muscles. That means it helps in head movement and also in the shoulder elevation. Accessory nerve is concerned with the head movement and shoulder elevation. Now the last cranial nerve is cranial nerve 12, that is hypoglossal nerve. Hypoglossal nerve, that is also a motor nerve. Hypoglossal nerve is also a motor nerve. It controls the muscles of the tongue and it helps in speech and also swallowing. So that is helping in the controlling the muscles of the tongue and aid in speech and swallowing. So these are the 12 pairs of cranial nerves. So while discussing this question, dash is cranial nerve 5. We got the correct answer, option D, trigeminal nerve. By the time we were able to recollect or revise the different cranial nerves, the 12 pairs of cranial nerves, and I hope this video helped you to get an understanding about the cranial nerves. Okay, thank you all of you.